Genital warts are small fleshy growths that can appear on the genital or anal areas of both men and women. They're caused by certain strains of the human papillomavirus, which you might know as HPV, which is a common sexually transmitted infection. Now, there are more than 100 different strains of HPV, but genital warts are typically caused by two types, HPV type 6 and 11. The virus is transmitted through sexual contact, which can include vaginal, anal and oral sex, and it is possible to contract HPV and develop warts even if the infected person doesn't have visible warts. In terms of signs and symptoms, well, genital warts can vary in size, shape and quantity. They can be small or large, flat or raised, and sometimes they cluster together in a cauliflower-like shape. In men, warts can appear on the penis, scrotum, groin, thighs, or even around the anus. In women, they can appear on the vulva, the walls of the vagina, the cervix, or around the anus. Now, most of the time, they don't cause symptoms, but both men and women can occasionally experience itching, discomfort, as well as bleeding from the warts. Sometimes people with genital warts might also notice that they have got pain or discomfort during sex, or they've developed problems peeing. So for example, blood in the pee, finding it hard to pee, or stopping and starting a lot, as well as not peeing in a straight line. So now that we've covered potential signs and symptoms, well, how are genital warts diagnosed? Well, to diagnose genital warts, a healthcare provider typically performs a physical examination of the affected area. They might use a special solution to make the warts more visible. Now, in some cases, a biopsy might also be taken to rule out other conditions. Now, in the UK, the best place to get seen if you think you have genital warts is a sexual health clinic or GUM clinic. It's free, you often don't have to make an appointment, and you can simply show up. And the health providers there will have dealt with this problem that you're facing many times before, so there's no need to be embarrassed. Now, the NHS recommends that you should see a doctor if you've got one or more painless lumps or growths around the vagina, penis or anus, you've noticed itching or bleeding from your genitals or anus, there's a change to your normal flow of pee, so for example it's begun to flow sideways that doesn't go away, or if you've got a sexual partner who has genital warts. Additionally, if you're pregnant and suspect that you might have genital warts, then you should also see a doctor because the condition can affect childbirth. Now, the good news is that there are different treatment options for genital warts, and the specific type is going to depend on the size, location, and number of warts. Now, some common treatments include topical treatments, so these are things like creams, gels, or ointments, which you can apply directly to the affected skin. Now, these will be prescription creams or solutions like imiquimod or podophyllin. Cryotherapy is another option. This involves freezing the warts with liquid nitrogen. Electrocautery is burning the warts with an electrical current. Laser treatment involves using a medical laser to remove the warts. And finally, surgical removal is an option. Now, this involves cutting out the warts, but this is usually reserved for larger or more persistent warts that are not responding to other treatment options that we've mentioned. Now, if you do use the topical treatments, so these are the things like the creams and the ointments, then it's really important to follow your healthcare provider's instructions carefully to avoid damaging the surrounding skin. Now, preventing genital warts is obviously better than cure, and preventing involves two main things. Now, preventing genital warts is really important, and the main forms of prevention involve two main things: practicing safe sex and getting vaccinated. Now, using condoms can significantly reduce the risk of contracting HPV, though they don't provide complete protection, as HPV can infect areas not covered by a condom. Now, the HPV vaccine can protect against the strains of HPV that cause most genital warts and cervical cancer, so it's really important to get vaccinated if you're eligible. For more information, check out the description box of this video.